This video is going to cover the Gonstead cervical chair Atlas setup. In the Atlas setup, the doctor's positioning is the same for every listing. We will just manipulate the patient's head positioning to accommodate our line of correction. First thing we need to do is locate our segmental contact point. It's important to locate the segmental contact point, the Atlas TP, because on every person that TP sits in a different orientation as compared to the mastoid. Sometimes it's tucked up very close to the mastoid, sometimes it's anterior, slightly posterior. So we must locate it first, so when we make our tissue pull, we know exactly where we're aiming for. Okay? I am still going to tuck the patient's chin. This helps me just control the head. I'm going to open up that space for the contact a little bit, just resting the patient's head in my palm on the left side. I'm going to take a tissue pull S to I from the mastoid to the TP, and the actual contact point, segmental contact point, is the anterior lateral transverse process. So I'll take my tissue pull S to I. I'm going to hook right around the mastoid onto the Atlas TP. I'm going to pivot my stabilization hand because I stabilize opposite the patient's Atlas, stabilizing C2. I'll laterally flex the patient over to the contact, and you'll see that my arm maintains its position fairly parallel to the ground. If I follow the patient down like this, I will not get my S to I orientation. I have to hold the patient, my arm, parallel to the ground as I laterally flex the patient over. What that allows is that as I laterally flex Atlas, now I have an S to I orientation to Atlas. Okay? So that's for an ASR listing. Now if I have an ASRA listing, I will laterally flex the patient to the right, and then I will rotate the patient's head 5 degrees towards the contact to give me an orientation of A for slight A to P for the ASRA listing. If it's an ASRP listing, I'll rotate the patient's nose or head 5 degrees away to help me take care or correct the posterior component on the rotational component. Okay? That's it for my Atlas setup. I will stand a little more to the lateral side for this setup so I can keep this elbow parallel to the ground as I thrust lateral to medial. The thrust for this one is lateral to medial for the doctor's impulse. And again, by orientating the patient's head into lateral flexion, that will give me the S to I orientation. And when I rotate the patient's head towards me, that's for the ASRA. Rotate the patient's head 5 degrees away, that'd be for the ASRP listing. Okay? We'll see you in the next video. For the Atlas adjustment, like I said, we're going to be on the anterior lateral TP of Atlas. So this marker is going to designate my Atlas. This marker is going to designate axis, so C1 and C2. For my ASR, we have an open capsule on the right-hand side. Since my doctor's positioning does not change with the patient, for me to get my S to I orientation, I laterally flex the patient now. So as I thrust lateral to medial, the positioning of the patient's head will allow me to correct the superiority on that side. Now if I have an ASRA listing, so Atlas has gone anterior to C2, I will laterally flex to take care of the open capsule on the right, and then I'll rotate the patient 5 degrees towards me. So when I make this correction now, I'll correct the ASRA component because I'll then be bringing the Atlas TP back towards the correct line. Now if we have an ASRP, Atlas gone posterior on that side, again with my same contact, laterally flex, and now I'll rotate the patient 5 degrees away. So when I make my impulse now, I'll correct the rotational P component when I thrust lateral to medial. Okay? So hopefully you get that concept in the Atlas rotational component correction.